and you can go through the Facebook also. Now directly I will invite today's session 2 resource person, Dr. Punam Bisht. I would like to welcome Dr. Professor Hegde sir to introduce today's resource person. Yes.
Yeah, thank you, Dr. Vidyasagar. It is my privilege to introduce today's speaker, Dr. Punam Bisht. And also I welcome formally her to virtually to Rani Channamma University. I once again thank her for accepting our invitation and
thank you, sir.
Giving
her
idea, sharing her idea with the students. So this virtual platform has opened up a lot of opportunity so that we can have much more such sessions. So it is my privilege and honor to introduce our speaker, today's speaker, Dr. Punam Bisht. Dr. Punam Bisht received her MSc from Government Medical College, Haldwani, Kumaon University, Nainital, Uttarakhand, and got her PhD in biotechnology from the same university. So she started her career as a lecturer at Punjab Technical University. Then she worked as a scientist at Arsh Biotech Private Limited, Delhi for some time. Then she joined as a research associate at International Center for Foot and Mouth Disease, Odisha. Then she has a vast research experience in life sciences areas such as a virologist. So she authored more than 20 research articles in high reputed journals such as ACS, RSC and Springer, etc. She is also a member of international bodies like European Society of Virology, life member of Israel Society for Microbiology and Indian Science Congress Association. So once again, I welcome Dr. Bisht to this session. And one request to all participants, if session gets cut off after 40 minutes, you can press the same link and the session will continue. That is also for your information, Dr. Bisht. Thank you, and you can start your session.
Okay. So, a very good afternoon to all of you, and thank you very much, Dr. Hegde sir, for nice introduction, and Dr. Vidyasagar for organizing and having me here. Thanks a lot. So let me share my screen with you. I will just start without wasting the time. I think you didn't allow me to share my
screen. Sure, I did.
Okay. Yes. Yes. Can you see my screen now?
Yes. Yes, I can.
Yes.
Yeah, we can see now.
Okay. So I'm going to talk on the current pandemic, that is coronavirus disease 19, or in short COVID-19. I'm going to cover the following points in my talk: origin of coronavirus, emergence of SARS coronavirus 2, that is the causative agent for the current pandemic, and the life cycle of SARS coronavirus 2 or CoV-2, host immune response, therapeutic approaches, and precautions. Okay, so okay. So these coronaviruses are the member of family Coronaviridae and order Nidovirales, or also called Nidoviruses. Nido means nest in Latin. So these viruses actually have 3' co-terminal nested subgenomic mRNA during infection. This is a kind of special feature of these viruses. We will talk about it in later slides, and that's why it's called nidoviruses. These viruses are enveloped viruses. They have a positive sense single-stranded RNA genome as a genome, and the size range of these viruses vary from 100 nanometer to 150 nanometer. On the basis of their genome size, these nidoviruses can be divided in two categories. One is with the large genome size, coronaviruses, and other two, torovirus and ronivirus, and the second category with the smaller genome size that range between 2 kb to 15.7 kb, the second category. So here we are going to talk about coronaviruses. So there are 4 genera in Coronaviridae family, that is alpha coronaviruses, beta coronaviruses, gamma coronaviruses, and delta coronaviruses. The alpha and beta coronaviruses, it's originated from bat, and the gamma and delta coronaviruses that originated from bird as ancestor, and these are different from alpha and beta. So here our focus will be beta coronaviruses, as we know the current virus strain belongs to beta coronavirus genus. So these are the viruses known. These coronaviruses are known from long time. This coronavirus 229E and this in bold, the OC43. These two viruses have been known to the human population from long time, more than 60 years, and the other two, NL62 and HKU1. These two viruses, in addition to these two, the total 4 viruses, 2 of alpha coronaviruses and 2 beta coronaviruses. These viruses are the causative agent of common cold, and they produce 20 to 30% of common cold. And we have known these recently emerged viruses, that is SARS-CoV-1, which caused SARS, severe acute respiratory syndrome, and MERS, as the name suggests, Middle East respiratory syndrome, and the COVID-19 caused by CoV-2. So these 3 viruses emerged recently in the human population, and as a total, we know these are 7 human viruses from these 2 genera, alpha and beta coronaviruses. So these the last 3 viruses, or the recent 3 viruses, these viruses directly did not infect the human population. They either come through species jumping or zoonotic transmission. We are sure about, there are a lot of research on SARS and MERS, and it is kind of proven, but in case of CoV-2 we are not sure. We will see in later slides. So if we talk about SARS and MERS coronaviruses, these originated from bat or bat coronavirus. Rather than infect human directly, these viruses come through intermediate host species. That means these viruses jumped from bat to intermediate host. Intermediate host. In case of SARS, the intermediate host was civets, and in case of MERS, the intermediate host was camels. After many rounds of replication, these viruses must have adopt some mutations, which mutations made those viruses able to infect to the human population, or they acquired those we can say mutations in order to become more pathogenic. And in case of the current virus, the SARS-CoV-2, we actually don't know if there is an intermediate host. There are many assumption or paper that they are claiming that it could be pangolin, because there is some sequence similarity between the coronavirus found in pangolin and the bat coronavirus, or it is also possible that it came directly to the human, as the sequence of human coronavirus and bat coronavirus is similar, around 98%. It is already been published. And what we know about this current CoV-2 virus is this virus is highly pathogenic, and this virus is able to transmit human to human. And as we all know, that this virus originated from Wuhan, China. So these are not the only viruses or coronaviruses in bats. There are more than 500 coronaviruses identified in China in bats. It's already published, and that can lead to the diversity of coronaviruses more than 5,000. So, this current pandemic strain may not be the last one, and it's very likely that there might be next pandemics from the coronavirus family, as we have already 3 pandemics or emergence in last less than 20 years. So this particular field really needs to study more, and there is already more research has been started in this particular field. So let's have a look on the disease severity from these coronaviruses or recently emerged coronaviruses. So the SARS-CoV-1, it emerged in 2002, and it caused 8,098 cases and 774 total deaths. And then the epidemic automatically shut off, and then we have the next emergence of the virus, that is MERS, and it causes 2,521 cases and 866 deaths. The death rate or the mortality was more or higher than the previous one, around 30%. And the third one is the current one is CoV-2. And this is the data from Johns Hopkins University. This is the data from last night. And as we can see here, already there are the infected number of cases is more than 75 lakhs, and in India itself it reached to the 3 lakhs infected cases, and more than 4 lakh deaths already worldwide. Sorry. And we don't know how many more numbers are going to add in this picture. So the current one is really different from the previous two, and it's highly pathogenic. So I just want to focus on 2 points, how this current one might be different from the previous coronavirus. Because there are many papers which say that the CoV-2 is similar to CoV-1. It is similar also, as their sequence similarity is around 80%, but in terms of severity of disease, it's highly pathogenic. The first distinction between these two viruses is intermediate host. In case of CoV-2, we know the intermediate host was civets. So we can really track those civets, and we can cull off, and we can control the disease. But in case of CoV-2, we really don't know whether there is the involvement of intermediate host or it came directly from bat. It's unclear yet. And the second and most important point is, in case of CoV-1, there wasn't a symptomatic patient. But in case of CoV-2, there are a lot of asymptomatic patient. We all know what is the meaning of asymptomatic patient. That means the person will not show any symptoms, but the person will carry the virus, and he will be able to infect others. So it's very difficult to track the asymptomatic patient until or unless we are testing for RNA detection or the nucleic acid detection level for whole population, which is not practically possible. So now let's have a look on the structure of coronavirus, mainly the CoV-2. We know that the virus entity that made of 2 things, the nucleic acid and the outer capsid, mainly it's protein. So here there are 4 major proteins that made of coronavirus. Here in the central, it's RNA genome, which is surrounded by ribonucleoproteins in yellow, and then it's surrounded by the membrane proteins in red, and along with envelope, this is envelope protein, the third protein. It's also called small membrane protein. And the fourth and the major or prominent protein is spike protein, because this spike protein play a major role during virus infection or virus entry. We will see in later slides. So this is very important protein in terms of infection, in terms of target. These because of these spike protein, the virus is called corona. Corona means in Latin crown. So under microscope, because of this spike protein, the virus looks like crown. So it's called corona. And the virus is pleomorphic. That means it doesn't really have a definite shape. And these viruses are enveloped, as I told you. And the size of this virus is around 125 nanometer. And here in the right, there is a cryo-electron microscopic image of spike protein. The spike protein is very important protein, so there is a lot of research going on this particular protein in terms of therapeutic use also. So the spike protein mainly made of three domains: trimeric protein. The upper one is receptor binding domain. It's a highly variable domain. We can see also in terms of color coding. So this particular domain is called RBD, receptor binding domain, and it binds with the receptor on the host cell. And second one is here, it's a fusion peptide or fusion domain here. So this fusion peptide, it helps the virus to enter into the cells by fusing this particular spike protein with the host cell membrane. So if we have a look on the genome of three important coronaviruses, CoV-2, this is CoV-1, and MERS. So I will go through the genome. I won't go into deep into the molecular biology or the genome. Generally the genome made up of 5' UTR, untranslated region. And then this is the polypeptide ORF1A and ORF1B. It mainly codes for non-structural protein like replicase enzyme, proteases, and many more. And then here the virus codes for structural protein. This is for spike and membrane protein, and 6, 7A. There are many accessory protein towards the 3' end, and 3' UTR untranslated region. So there is 80% sequence similarity between coronavirus 2 and coronavirus 1 here, but there is some differences as well. Like you see here in red dot, these are the changes in the genome level here. These are the changes in the coronavirus 2 when we compare with coronavirus 1. So there are assumption, or there are a lot of research going on. Might be these are the changes in this virus. It's making it more pathogenic. So here, so how the virus enters into the human system or a host or human cells. So we know that in order to enter into the human cells, a virus needs to attach with the receptors. And here in this case, the receptor is ACE2. This is angiotensin converting enzyme 2 receptor, which is common for CoV-1 and CoV-2. Hence, there are reports that this receptor in this case, the receptor binding with the spike protein in CoV-2 case, it's stronger than the earlier one. And these receptor is expressed by mainly or in high frequency by the alveolar cells of our respiratory system in high frequency, and also expressed by intestinal cells, heart, and kidney. First, we know, I just want to tell you how a virus infects or enters into the human system. We know that, and also in the previous session, Dr. Sridhara, he told how the water droplets come from an infected person and how far it can go. So mainly the virus comes in water droplets either by sneezing or coughing from an infected person, and it will mainly enters through nasal route, and it sits in the nasal cavity for first few days or do replication there. Then it travel down to the respiratory system, mainly the lower respiratory system, where it is able to bind to these receptors, or wherever it will see the receptors. So here two important components. One is this ACE2 receptor, and the second one is TMPRSS2. So the first thing, the virus will bind, mainly the spike protein will bind to the receptor. It's kind of lock and key theory. And then the virus needs the TMPRSS2. This is also very important in this case to get entered into the cells. So the TMPRSS2 then activates the spike protein or cleaves the spike protein, and then there are some conformational changes occurs in the virus, and the fusion domain of this spike protein then fused with the this membrane of host, and like this it and then it enters into the host cells in a form of endosome. So here comes to the life cycle, how the virus survives inside the host cell, or what is the life cycle of the virus inside host cell. So once the virus get enter into the host cell with the help of ACE2 receptor and also TMPRSS, here is the vesicular form or endosome is here. I will talk on this endosome later in terms of therapeutics. Okay, so then the virus the virus fused either with lysosome, or the virus uncoat itself from this endosome and endosomal part, and the genomic RNA comes outside the vesicle. And as I told you that in this case, this genome is single strand RNA genome, positive sense RNA genome. Positive sense means this RNA can directly act as mRNA or messenger RNA, and this can be directly read by the host ribosome, and it can directly translate viral proteins. So here we can see it translates into two ORF1A and ORF1B, and the virus is very smart. It has some frame shifting mechanism here in order to produce its both the polypeptide, and further this polypeptide is cleaved by proteases, which is also encoded by the virus in order to get other non-structural proteins. So once the virus made its non-structural proteins, the virus starts replicating here, because it need RNA-dependent RNA polymerase (RDRP) to make its own copy or to do replication. So the virus make its copies here, and also in parallel virus make its mRNA copies for the structural proteins, and these are also called subgenomic messenger RNA. And this is the special feature of these viruses. It's not common for other viruses. So the virus have different mRNA for different structural protein, for spike, for envelope protein, for membrane protein, or other accessory proteins. So after the replication and in parallel translation and transcription, here is the translation for structural protein, which occurs in endoplasmic reticulum. The virus goes to intermediate ER and the Golgi complex, and here the virus assemble itself into a new virion. The nucleic acid, the newly formed nucleic acid or RNA assembles inside the protein structure, and through the process of exocytosis, the virus released from the host cell, and it infect the neighbor cells or in order to continue the infection. So this is the life cycle of coronavirus inside the host cell. So once the virus infects the host cell definitely will react and try to defense themselves from the infection. So the defense system is host immune response. We know that the immune system fight against any of the infection. In some case, it's succeeded, and if not succeeded, then the infection goes on or become fatal. So here. So here we can see that when the active replication or virus infection goes on in a particular cell, the virus activates its immune system, or we can also understand in this way that the infected cells secrete some molecules. It's called damage associated molecules. Those here in this case, those are ATP, ASC oligomer, and host DNA. And these molecules are recognized by neighboring cells, epithelial cell, endothelial cells, these neighboring cells, and the neighboring cells also respond against these signals, and there is a kind of activation of immune response, and or we can say there is pro-inflammatory cytokine activation takes place. Then mainly it's interleukin 6 and MCP, IP10, and many more. So once the pro-inflammatory cytokines activation takes place, it attracts the other immune cells also, like T cell, macrophages, and monocytes at the site of infection, and leads more inflammation in the infected cells. So there is a situation, it's called a cytokine storm. So so from here there are two cases. If the immune system is weaker or defective or not able to fight against the pathogen, so in this case the cytokine storm will lead further inflammation, and eventually it damages the cell here, and then the cell further release more cytokine, and these pro-inflammatory responses which circulate in the system, and which goes to other organs as well, and there is a condition of organ damage or multi-organ damage. So here, and in other case, when the immune system is strong enough to fight against this particular virus, when the virus infects a cell, the cell respond against it, and the immune system activates and will able to make the T cell effector T cells against the particular virus, and the cells clear the virus infected cells as soon as possible in order to block the further infection, and the T cell activates the humoral immune response, where it will make a neutralizing antibody, and this neutralizing antibody will block the spike protein on the surface, and there won't be any further virus entry. So this is how the immune system fight against the infection, and in this case there will be least damage of the organ or lung or the cells, but in other case it can be fatal. Okay, so now what could be the therapeutic approaches against SARS coronavirus? So the first point of entry is this virus entry through the ACE2 receptor. So the first approach could be, or it is also being used, you must have heard that monoclonal antibody is there, and plasma therapy. So when we have the CoV-2 specific antibody already available in the immune system, these antibodies block the spike protein, and the virus is unable to infect the cells, because this spike protein has been completely blocked, and there is no more attachment with the cellular receptor ACE2. And the second point of blockage or approach could be the blockage of this TMPRSS2 protease. There are many research papers and many studies going on in the labs where they have seen positive result for the inhibition of this TMPRSS2. There are many molecules. If we will be able to inhibit this particular protease enzyme, then there won't be further infection. And you can understand, then there won't be further activation of the spike protein and further entry. This is the second point where we can stop the virus from infecting the cell. And the third would be we can have the virus specific CD8 plus T cells, which is also called T cell therapy, and which can help the immune system to fight against the virus. And the fourth one is quite novel and a different approach. I told you that whenever there is infection in the host cell, there is pro-inflammatory cytokines or non-specific immune cell activation takes place. So this procedure says that we can purify these pro-inflammatory cytokines from a person's from an infected person's blood, and then after purification we can send it back to the person. So it's quite novel, and I didn't read, or I didn't find a lot of research on it. Maybe it's going on or not published. So here is the broader picture of the therapeutic targets of the coronavirus infection in parallel to the virus infection. So we know now how virus infects the cells. It makes its copies, and it synthesizes its protein with the help of host cell machinery, and then it goes out by the process of exocytosis. And here we already discussed that we can block the spike protein here in terms of convalescent serum or vaccine. So either we can block this entry point, or we can block the template 2 enzyme. Or the third approach, here I told you about the endosome. When the virus get fused with the host cell membrane and it forms the endosome vesicle. So the next step is the virus needs to come out. It needs to release the genome, the RNA genome into the host cell. So to do this, the endosomes are basically these are the acidic vesicle, and it needs acidic pH in order to do that. So you must have heard about drug chloroquine or hydroxychloroquine. So these are the drugs
YouTube link.
Sir, continue ಇದೆಯಾ ರಾಚಾಯ್ ಅವರೇ?
ಕಂಟಿನ್ಯೂ ಮಾಡ್ರಿ. ಯೂಟ್ಯೂಬ್ ಅಲ್ಲಿ ಕಂಟಿನ್ಯೂ ಆಗತ್ತಾ?
ಕಂಟಿನ್ಯೂ
ಇದು ದೊಡ್ಡದು ಮಾಡ್ಕೊಟ್ರಿ ಲಿಸ್ಟ್.
ಬಂದಿಲ್ಲ.
ಬಂದ್ರ ಮೇಡಮ್? Hello, ma'am.
Hi, it was interrupted, and I assume you told me earlier.
Yeah, because another session is going on in other department, so they are continuing. So we didn't get the license to Zoom, their Zoom. So
Okay.
It's okay. Once again, we will admit all. Sorry, ma'am. Sorry.
unmute yourself on that. Unmute yourself.
Yeah.
Yes.
Yeah, okay.
So can we continue now or?
Yeah, we can continue, ma'am.
Okay.
1 second. Continue.
Continue, ma'am. Please go ahead.
Okay. Okay. Let me share my screen. Please permit me to share the screen. Give me permission for it.
Yeah, now.
Yeah.
So sorry for the interruption because of there was some technicality. So here I was in this point that you must have heard about chloroquine or hydroxychloroquine. It's being used to treat the corona patient, and although this drug is not for corona, it's an anti-malarial drug and it has a lot of side effects. That's why it was banned in most of the countries. So here I will just tell you how this drug actually acts in case of corona infection. So I told you that there is an endosome and the virus needs to take out its RNA genome in order to do the replication and further infection. So the hydroxychloroquine or chloroquine, it is an alkaline drug, and this drug made these endosome or these vesicles very alkaline. So the virus is unable to take out its RNA into the host cell. That's how it might block the further infection. Here. Yes, and the second point of blockage could be the polymerase, the RNA-dependent RNA polymerase. As I told you, it is very important to make the viral RNA copies. So we can block this particular stage, and we can use a number of drug here. And if you are aware that there are some of the papers where they are using remdesivir. One of the drug has been used for Ebola virus, although this is also not the drug for coronavirus, but people used it either alone or along with hydroxychloroquine, and there was some result, although there was some side effect as well. So what remdesivir does, it blocks the polymerase, RNA-dependent RNA polymerase. Here it needs for making viral copies. If it will block the RNA polymerase, there will not be further replication will be going on in the virus infected cells, and no further infection. And the third point could be the innate immune response. We can boost the host cell immune system by providing a number of factors, the interferons and other factors. Here. And the fourth and the last point is either we can block the unnecessary or non-specific cytokine storm, or we can provide a virus-specific or other interferon. Also, I didn't heard about it much, so I'm not going into deep. I think that the first two here, most of the research is going on the first two steps, either blocking the entry of the virus here, and the second one is I think this is the important point, to block the virus, the replication polymerase, and there is a lot of research going on these 2 points. So when a person is infected with coronavirus 2, we know this slide or these things we all know. Just I will go quickly over it. So these are the number of common symptoms here. Anyone can confused with cold, and these are the number of symptoms called uncommon in this particular case. When we feel, or anyone we know that those are facing these uncommon symptoms, they should seek the medical care for sure. And most of the cases, if these symptoms are left untreated, they may be complicated, and they may lead the complications. The most common is ARDS, acute respiratory distress syndrome, and we know that this virus mainly firstly target our respiratory system and it could be fatal by failuring our respiratory system and leads or may lead to other multi-organ failure. So I'm going towards end, and here is the precautions. We all know that there is no medicine or no drug or vaccine available yet. So the best way to save ourselves from the coronavirus infection is to take precautions. I know you all are aware from these things, but I will insist to go through over it again, because we know many things, but we don't apply on ourselves. So in order to save ourselves, we need to take precautions. The first and foremost thing is to clean our hand, to wash our hand with soap. If we are at home, the water and soap is available, I will insist we should use that, not sanitizer all the time. And if it's not available, we should use alcohol-based hand sanitizers, as we all know. And we should wear mask whenever we are going out of home or in crowded place. So we should wear mask, and how to wear mask, everyone knows it, but I would like to go over it quickly. So we should ensure that we are not using the damaged mask, first thing, and we should wear the mask properly. We should cover our nose and mouth. If we are, I have seen many people, they are just putting the mask over mouth. There is no point of wearing mask then. We know that the virus enters through nasal cavity. And second and important thing is we should not touch our mask from front. We should always handle it from the side, either when wearing or removing. And the last and important thing is we should properly discard the mask, because it's a lot of biological waste and it could be very dangerous for other persons if you are infected or asymptomatic. So this is very important, and alone mask is not going to save us. As we know that, we heard in the morning session, Dr. Sridhara, he told that the virus could travel up to 6 meters. So at least we should maintain 1 to 2 meter distance. 6 meter is not feasible, I know. Then we should maintain some distance when we are in crowd. And second thing is related to the mask. What we should not do, we should not touch our mask from the front. We should not touch our face. We know that when we are going out, we are touching other things, and the virus can be prolonged there. The prolonged existence of this virus, we knew that yesterday. Professor Victor told us that it could be there for hours, for 2 days, 3 days, 6 days. We don't know, and it's not clear yet. There are a lot of things going on about this. So if you touch something outside and then you are touching your mask, then you are infecting yourself, not consciously, but it happens. So these are tiny things but important things. And we should follow the guidelines of WHO, CDC, and ICMR for India. And we know that India is already reached at community transmission mode, and most of the cases we don't know the source of infection. So this is really going to be important point at this stage, and precaution is the only way to save us. This is what I will say, and I will conclude with this. Thank you for listening, and I wish you healthy and safe health ahead. Stay safe. Thank you very much for listening me.
Hello, ma'am. Can you hear?
Yes, I can hear you.
Okay, it was a nice presentation. We will have only 1 or 2 questions from the audience. Okay. Vikas Kumar. Hello, Vikas Kumar.
Yes, sir. Am I audible, sir?
Yeah, you are audible. You can go ahead.
Thank you so much, Punam ma'am. Ma'am, actually, I have read lifetime of coronavirus on many other surfaces like wood, glass, and I will know how to disinfect these surfaces. But ma'am, should we concern about food and vegetable? And actually my question is how to disinfect food and vegetable after buying from markets?
Okay. Thank you, Vikas. Your question is very logical. And I just want to tell you that it's really not clear yet, because is a lot of research and lot of researcher and different perspective. And there are different kind of research on those things, that how long the virus persists on the surface of wood, metal. Definitely on metal it's more. It's about the things outside. And we really need to be careful about those. And now to come about the food and the packets or the goods we are purchasing for home. I don't know it's available in India. I'm sure there must be. There are wipes from which you can wipe your packets. If the food is packed, you can use some disinfectant, of course, or you can even dip into the soap water, or you can disinfect them, the packed food. And the only way to disinfect them is to wash them, I think. And what I do, or what we all are doing, I think, to wash them. Or we know that this virus can be killed by detergent or soap, because it's enveloped virus, it's lipid bilayer, so this will be degraded for sure with the soap. If you cannot use soap every case, use hot water or try to keep things away for a few hours and take precautions. I hope you. Hi, hello. Can you hear me?
Yeah, I can hear. One more question we have from Basappa. Can you hear Basappa?
Good afternoon.
Very good afternoon,
sir. Nice presentation. So my question is related to the antiviral therapy that is existing now. So unfortunately, none of the drugs presently approved from FDA are kind of this gold standard drug what we use, hydroxychloroquine, doesn't help much. Okay. So what is your message in terms of remdesivir failure in clinical trials? So is there any new research data that focuses the new analogs of remdesivir, or is there any other kind of Japanese drug, flavipir? So that is also doing much better efficacy in phase pre-clinical trials.
Okay, thank you. It's a very good question and factful question, sir. So here I would like to say that there are a number of drugs which has been trying by the hospitals by the clinician, and also in vitro in the labs like we do. So there are results also for some patients. Actually, the immune system is not act similar way for all the persons. So it's very likely that maybe some drug is working for some patient, may not work for other patient, because there is a lot of immune conditions. The other person may not be that much healthy. They may have some medical conditions like diabetes, or they might be immunocompromised. So there are a number of facts there. So yes, I know that there is a lot of drugs which has been tried, or people are still trying them. But I really, this is my personal viewpoint, that I really don't think that any of them is particularly fit for this particular virus, because this virus is different from other virus, and those drugs are designed for other viruses. So people are trying. I think it's one saying that it's better to have something than nothing. So until or unless we have a particular drug for this particular virus, people want to save life, and they want to try different drug. If something works, then it's okay. If not, and I don't think they are trying on like mild patient. When the person is severe, then only they are going to try those heavy drugs like hydroxychloroquine. We know there is a number of consequences. These are immunomodulatory drugs, so it is possible that for many patients it can be fatal, and it is. There are research papers. My suggestion is, as we know about the research, there are already a lot of clinical trial going on. It already reached to human trial. So I wish we will definitely have some solution or specific vaccine or at least MAB, monoclonal antibody, for this particular virus. Thank you.
Thank you. Thank you. Thank you.
Hello, ma'am. We have a last question from Pranay.
Okay.
Pranay, can you hear? Pranay? Pranay? Can you hear, Pranay? Okay. Can you hear, Pranay? Okay. In that case, we'll end.
Hello, ma'am. First of all, thanks for this informative representation. My question is very simple. That many of the places have come and go without any vaccine. For example, in India, there are Kerala. There is the Nipah virus has been come from this similar bat, and it go without any vaccine. Do you think that this corona before the vaccine has been go?
Okay. If I understand, hi, can you hear me? Pralay, right? Pralay or Pranay?
Hello, Pranay?
I think he has some technical issues, but if I got him correctly.
Yeah, you go ahead, ma'am. You answer him.
Okay. So if I got him correctly, he want to ask about this infection might go untreated, or it will automatically set off without any vaccine or treatment, I think. So well, I don't know about it yet, and many of us we really don't know. It might be or might not be, because the previous SARS coronavirus one, we have seen that it automatically shut off. But in that case, we knew the intermediate host, and we knew the infection is hospital-based infection. It wasn't transmitting human to human like now. The current one is declared as pandemic strain, so it is more pathogenic than the previous one. So at this point, I really don't know if it will go automatically shut off. If it will go also, by then we will lose a huge amount of people and a lot of economy, or many more, as we all know.
Okay.
At this point, I would like to say to you, please take precautions. At this point, precaution is the only way to save us. And I'm sure as a biologist, I have faith on the scientists who is working on it. They are working day and night, and we will soon have some solution for it.
Thank you. I have one question, ma'am.
Okay.
Is it possible to re-getting this coronavirus in future if we get a second time in future?
The same? You mean the same coronavirus too, or some different coronavirus?
Maybe the same coronavirus.
Okay. Yes, there are cases also of recurring. Sometimes that infection recurs. It called in terms of recur of infection. The same virus can infect you again, but second time it might not be that much severe for you, because you already have antibody against this virus. But it is yet unclear that how long this antibody will persist in your immune system. If it is within months, like I worked with one RNA virus, and I have seen FMD virus. I have seen the practically in the lab and in the field, we have seen that the antibody exists for 6 months. So we don't know yet how long these antibody specific to this particular coronavirus too, how long it will persist in particular immune system. So if antibody is there, of course, you will be not highly infectious, or you will be automatically cured, and it won't be fatal. Matters how long it persists and when you can get the infection again.
Okay. Thank you very much, ma'am. Thank you very much. Yeah. Now it's time for a vote of thanks for our eminent resource person, Dr. Punam. So she gave a brief description on a structural model of the coronavirus, overview of the COVID-19 SARS-CoV-2, and therapeutical targets, how to wear a medical mask and how to take care in future and all. So in this connection, directly we'll go for vote of thanks. It's my privilege to extend vote of thanks on this occasion to Dr. Punam. She took her valuable time from her busy schedule. I must mention deep sense of appreciation for Dr. Punam. But for her, we are really glad to have scientists like you, and in future also we will be having once again, ma'am. Thank you very much. And I'm first of all, I would like to thank our Professor Ramachandragowda sir, Hon'ble Vice-Chancellor, Rani Channamma University, for supporting to conduct these kind of webinars, and Professor Basavaraj Padmashali sir, Registrar, and for all my Department of Chemistry staffs and everything. Once again, thank you one and all. Thank you for all the participants for participating in the last session. Thank you one and all. Thank you, ma'am. I will message you. Thank you very much.